Welcome to the Gynarchy Podcast. This is your host, Dr. Gynarchy Patel. Here we place women's health and feminism front and center where they belong, engaging in conversations that range from the fundamental to the fearless. With insights from expert guests, we aim to break through the barriers of the patriarchy and envision a new world led by the Gynarchy. So let's get started and dive right in. Welcome to the Gynarchy Podcast. This is your host, Dr. Gynarchy Patel. And today we're going to be speaking about pain with sex. And my guest is Dr. Sadaf Lodhi. Dr. Sadaf, as she's known, is a board-certified OBGYN, Menopause Society Certified Practitioner, a fellow of the International Society for the Study of Women's Sexual Health, ISWISH, and has a podcast called the Muslim Sex Podcast. She has given a TEDx talk on the topic of sexual education for physicians, lessons from a Muslim gynecologist, and was awarded Alumni of the Year last year by the University of Michigan for her advocacy work through her podcast. She is also one of the co-authors of the book Thriving After Burnout. So welcome, Sadaf. How are you?
Good. Thanks so much for having me on, Gynarchy. I appreciate it.
Thank you so much for joining me. So I love your background. Is there anything else you'd like to add that I maybe left out?
No, I've been in practice now for outside of residency 21 years, and I opened up my own concierge practice in New York. But I think you covered most of the other things. I am also a co-author of one of the books called Made for More 2 with Dr. Una that I was an author in, and I'm writing my own book.
Oh, wonderful. So what is that book that you mentioned? What is that about?
Which one?
The first one.
The Made for More 2. Yeah. So that's basically, it was a collaboration of a bunch of authors, and we came together to talk about how we're, as physicians, we're seen as just kind of, working for other people. And a lot of times that leads to burnout. And there's so many demands on physicians. And, being a gynecologist yourself, how stressful it can be to be an OBGYN. And so this book was about how we are made for more, whether it's private practice, whether it's coaching, whether it is doing podcasts, whether it's, so many other things that we can do. And so it's basically about redefining your life based on your own terms.
Oh, wonderful. Is that with the Thriving After Burnout book was also similar?
Yeah, so there were two separate books. So they were, the Thriving After Burnout was with Dr. Sharon McLaughlin. She has a Facebook page herself about just female physician entrepreneurs. And so that was a similar idea. It was, a bunch of authors that came down. So it was both like similar ideas.
I'd love to know what the book is that you're working on. If you can give us a sneak peek, you don't have to, but
I'm working on a book. It's going to be called Give Yourself Permission, A Woman's Guide to Experiencing Pleasure in Her Relationship.
Amazing. I hope you'll come back and talk about that.
Yeah.
So you're now my third ISWISH member that I've had on, and I'm of course also a member. And I think I did an episode with Samina, who I think you know, and we were just talking about how it's like a cult. Like once you go to a meeting, you're just like, oh, these are my people.
Yeah, absolutely. No, it's great. You're right. ISWISH is fantastic. And I learned so much there. Every time we go, it's just amazing. I think it's so important to stay on top of the research, but also to be well-versed so that you can help your patients.
Yes. And I listened to a couple of your episodes. I just listened to the one with Irwin Goldstein, which was amazing. And now I'm like, oh, that's my life goal. Another goal. Like I need to get him on this show.
Yeah. He was great.
That was great conversation. Yeah. So I also love what you're doing here, advocating on behalf of your Muslim community. And it's so like, what I know you can't do a whole TEDx talk right now, but I would love to know like your feelings on why it's important, to look at, for us physicians to look at GYN care through this intersectional lens.
Yeah, I mean, so as you know, women in general, right? We don't have much research done on us. And it wasn't until 1993 that women were even included in scientific research in terms of being participants in studies. So as you know, there's definitely a big void in research regarding women, but also, specifically minorities and Southeast Asian populations and Muslims. And I think that Muslims, a lot of times people have a lot of connotations around what a Muslim woman is, who she is, what she believes. And I think everybody has their own assumptions. And so I'm here to kind of break through some of those, preconceived notions and assumptions. I think that, Muslims are not a monolith. Not everyone believes the same, in terms of, obviously there's basic pillars, obviously, that are all the same, but I guess in terms of religiosity, right? Not everyone is the same. And I think that it's really important to know and understand that there are basic cultural norms that exist in the Muslim community when it's in regard to modesty. And I think it's really important for people to know that. But really, I think what I want most, honestly, to show people from, a podcast that's really titled the Muslim Sex Podcast, is that I want people to know that Muslims are just regular people, right? We're just like everyone else. And, Muslims have sex. And it's really just to shine a light on just our own biases. And really to make people aware that, everyone has the same concerns, right? We all worry about painful sex. We all worry about, what happens in menopause, what happens in perimenopause. And as a physician, as a provider of someone that may be taking care of a Muslim woman, it's important to understand that, sure, she may prefer a female provider as opposed to a male provider. Maybe she's, very modest. And so just to respect her modesty. And I think it's just important also to know that Muslims were Islam itself is very sex positive. And I think a lot of people don't know that. I didn't know that, I'll be honest. I didn't know that until I started doing my own research and looking into history. And I realized that Islam is very sex positive. And so when you realize that, well, then how did so many people, why do so many people feel that it is sex negative? And I think you have to go back and take a look at the history. And when you realize that, a lot of the areas where Muslims reside were colonized by, had colonial rule for a long time. And specifically in Southeast Asia, we were ruled by the British. And, the British then brought over their puritanical views, which then, we adopted. And then all of a sudden now sex is seen as something that is wrong, shameful, dirty, when, back in the Muslim history, and I think also in perhaps, maybe you can speak about Hinduism a little bit. I don't know if you are Hindu, but, that idea of sex positivity has kind of been lost. And it's unfortunate. And I think that a lot of times, we've adopted these puritanical views and, women's bodies oftentimes I feel are enshrouded in a lot of shame. And, I know a lot of people in Southeast Asia, and specifically I can talk about Pakistan, and because I'm Pakistani, and I know that, we don't talk about periods, we don't talk about menopause, we don't talk about, even when a woman gets, pregnant, what to expect and things like that. And I think that really does a disservice to our community. And we don't really realize, we're not teaching our girls, and not everyone, but, I feel that, sometimes women don't get the education that they need around their bodies. And then that leads to, again, shame and mystery, and you're not sure what's going on. And so I'm here to basically empower and educate women about their bodies. And specifically, my goal is more for globally. I feel like here in the US, we're very fortunate. We have so many things at our fingertips, so much knowledge and education, things like that. And my podcast specifically, the most downloads actually are outside of the US. They're actually in India.
Wow.
Yeah, the country that downloads my podcast the most is India. Then it's the US. And I was just looking at those numbers today, and it's close to 100,000 downloads, and I'm really excited about that. But I just want people to know that there is access to information, and that I want people, women globally and men and whoever is interested, to have that knowledge available to them without cost. And I think it's really important to impart knowledge and education. And I want women to feel empowered about their bodies and have sexual agency. And that's really my goal. And that's really why I do what I do, So the name itself, Muslim Sex Podcast, came about from a discussion with a friend of mine who, 4 years ago, she was like, oh, we should do a podcast. She was a lay person. She's like, I'll be the lay person and ask you questions, and you can be the gynecologist and answer, blah, blah, blah. And so as we were coming up with names, she's also Muslim. She's like, we should call it something that, really stops people in their tracks. And I was like, yeah,
Yes.
everything about names. And she was like, we should call it the Muslim Sex Podcast. And I was like, hell no, I'm not calling it the Muslim Sex Podcast, right? There's a lot of
Yes.
like, oh my God, what are people going to say? What's my community going to say? All the stuff, a lot of my own like cultural conditioning. And she was like, no, we have to, it's bold. It'll get people's attention. And we want people to want to dismantle, the stigma and all of this stuff. So anyways, I had to work around my own, I don't know, I guess, worry about what people would say about this. And then now I just own it. I really appreciate the fact that I can do something like that. And I did get a little bit of pushback initially in the beginning. And of course, there are people that don't want to be on it because of the name. They feel like it's one that sometimes they feel like it's only for Muslims, which I definitely encourage everyone to listen to. It's not just for Muslims, it's for anyone really who's interested about menopause, perimenopause, and sexual health. And I do coaching on there, and I have sex therapists on there and all of this stuff. So it's really important information. But two, there are some people that feel nervous about the name, and so don't want to come on it because of that. And I can respect that. It's not a big deal to me. I mean, I don't, it doesn't matter. But yeah,
I really love the name. I think that, I think you're debunking a lot of probably myths about, Islam, because you never see the phrase Muslim sex out there, because it's probably people are afraid to say that phrase. But I think it's really good. And I very much related to a lot of what you said. I do think there's a lack of education, lack of free education, education in our schools as well. So I share that mission with you with the podcast. And so I think what you're doing is brilliant. And I also could relate to, some of the other things you said, like certainly I was raised Hindu, and similarly, we have, not enough education, even in your families or homes, because there's a lot of shame around these topics, sexuality and things. And so actually it's funny because one of my big jokes I make is, no one wanted to talk to me about anything. So I became obsessed with it. And that's why I became an OBGYN. It's like nobody answered my questions. No one knew, or, it's also like our women, the matriarchs also didn't know enough about their bodies. So it's not their fault, so we're filling that gap. And the other thing I could very much relate to is, I do think, India had British rule, and I do think they brought their culture, and it did kind of harm things. The colonialism did harm things. I think that was the source of developing some of these, attitudes about shaming, sexuality, or something very natural, right? Which I think our religions don't necessarily have God, our Hindu, our Indian culture is known for the Kama Sutra of all things. So anyway, let's get to the topic. So why I chose this topic, as we know, pain with sex is, or as we call it, dyspareunia in medicine, is super common. It occurs in something like estimated 10 to 20% of women, and it's often misunderstood, dismissed, and undertreated. So, and it can really deeply affect women's lives, self-esteem and their quality of life. And so I thought it was a really important topic. So do you want to define for the audience maybe like what we consider,
Absolutely.
or how we define female sexual pain?
Sure. So, there's different, Female sexual pain, presents in different ways. The way that we typically, will hear about it as a clinician or a practitioner, somebody will come in and talk, that they have pain with intercourse, penetration, and, perhaps sometimes they're not able to have penetration. And so the definition that we have with Ishwish and with other, it's actually a DSM-5 category now. I believe it's not the DSM-4 anymore, but 5, but it's now grouped under female genital pelvic pain dysfunction. And it was previously known as vaginismus, hypertonic pelvic muscle dysfunction. And the way that we define it is that it's persistent or recurrent difficulties with either vaginal penetration during intercourse or marked vulvovaginal or pelvic pain during genital contact, or there's, a lot of fear or anxiety about vulvovaginal pelvic pain in anticipation of, during, or as a result of genital contact. There can also be marked hypertonicity or overactivity of the pelvic floor with or without genital contact. So before, they used to separate the definition of pelvic pain and vaginismus, but now they've combined the two terms together. So now it's one diagnosis. And so as you know, as a gynecologist, that when we talk about vaginismus, and I think vaginismus is really, really common. In fact, I had somebody from Michigan call me because I do telehealth in Michigan, and she's been married to her spouse now for 8 years. And during those 8 years, they've not been able to have intercourse, vaginal intercourse. And that's obviously caused a huge strain in their relationship, in their marriage. And I'm really impressed that, she's been trying, she's been going to a pelvic floor therapist. But as we know with vaginismus, a big component of it is psychological, right? So if she's not seeking out whether it's coaching or if it is therapy, then it's hard for that treatment to work. So she needs, we need that in sexual medicine, anytime somebody comes in with vaginismus, they're going to need a three-pronged approach. They're going to need a sex med doc that can see them, that can evaluate them, that can give them a diagnosis, but also, if the patient needs it later on, perhaps even Botox of the pelvic floor. We know that they're also going to definitely need to work intimately with a pelvic floor therapist that can help to, teach them how to relax those muscles, how to loosen up those muscles, perhaps how to work with a dilator. And so with those muscles, and preventing them from tightening up. And we know absolutely that there's a psychological component, and the person will need a sex therapist to help them kind of go over what their thoughts are, right? Because we know that what happens is that there's such a fear of this penetration and that it's going to cause pain that it automatically causes those muscles to tighten up around the vagina. And for people that have vaginismus, they say that, their partner almost feels like there's a wall, like they just cannot get through. It is, the muscles are so, so tight. And I don't know if you have, but, I know that when I've done deliveries in the past, right, I've had patients, not necessarily, they don't have to be of a particular ethnicity, but, sometimes you'll have those patients that are really, really fearful of those pelvic exams, even while they're in labor, and have such a hard time. I know that it's been so bad for a few patients that they've requested as a cesarean section because they just could not tolerate that vaginal exam. So it can definitely lead to really big problems, and, not consummating a marriage is definitely one of them. So I think that it's a huge problem that often goes undiagnosed and unrecognized, and, often dismissed by practitioners that will tell their patients to, perhaps just relax more, or, have a glass of wine before sex, which I think is really not acceptable, especially when, these patients, a lot of them have been suffering for a long time.
Yes, I'd say that's probably the number one reason for sexual pain that I see that very often. And to your point, there can be, not all the time, big psychological component. I sometimes will ask, I tend to ask this a lot, but anyway, but in these patients in particular, I like to ask about any history of trauma, trauma to the pelvis or sexual trauma or childhood trauma and I see a link with, patients even coming in and saying to me that they feel that it's their sometimes religion or cultural upbringing that causes them to have a lot of anxiety or stress about sex. And again, the muscles contracting is not voluntary, it's involuntary contraction. So it's something that they're not doing intentionally, that they can't just have a glass of wine and relax about,
Right. Yeah, absolutely. So yeah, I mean, I think that, it is a huge problem. And I think that some people can even have secondary vaginismus, right? When they may have never had problems with intercourse, and then all of a sudden they develop something like lichen sclerosis. I had a patient actually in the clinic that developed secondary vaginismus. She talks about how she'd always been able to have sex without any problems at all. And then all of a sudden she developed lichen sclerosis. And then, she started to have narrowing of the vaginal opening, and she started to have this scarring and these cuts and all of this. And then it started to become so painful that then she couldn't have sex anymore. And then all of a sudden her muscles, right, in trying to protect her would start to tighten up. And then all of a sudden she started to develop this vaginismus, which was very difficult. I actually had a patient also that, like you mentioned, actually cultural upbringing, she was actually Catholic, right? And we think that, when you think of vaginismus, I know a lot of people will think of like perhaps Southeast Asians and things like that. But I had this woman, she was African-American, she was Catholic, and she just couldn't understand why she was experiencing this vaginismus. And so then she and I started talking, and she told me that, in her first marriage, she had no problems. It was, totally, she didn't have vaginismus. And she said now she was in this other, she had gotten, since had gotten divorced and was in this new relationship. And, when she was engaged to this person, but when they tried to be intimate, when they started to have sex, her muscles would tighten up and she just couldn't figure out why. And then we started talking. And the reason why I bring up Catholic is because she, started telling me about how in Catholicism, it's considered a sin to have sex outside of marriage. And she's pretty religious. And so for her to have sex with her fiance before they were married was, in her mind, right, because she was so religious, it was wrong. And so her muscles then were starting to contract. And then she wasn't able to have penetrative intercourse with her fiance because she felt like she was doing something wrong. So I think that, with vaginismus, actually, I think that there is a huge component of, psychological things going on, right? Because we know that our thoughts control so much of what happens in our brain. And we know that the brain is the biggest sexual organ, but we know that our thoughts then lead to feelings, which then lead to action. So if somebody's thinking that sex is wrong, it's dirty, it's shameful, and I shouldn't be having it, and it's a sin, then the feeling that's going to come about is perhaps one of guilt or shame. And then the action that's going to happen is that the muscles around the vagina are going to tighten up. Right. And to protect yourself from that guilt or that shame that you're having, that you're experiencing. So we talked a lot about that. And I'm also a sex coach. So, we talked about that and what she wanted for her relationship and what she saw, and what she decided for herself was that because she felt like it was a sin, it was going against her values of what she believed, she decided she just wasn't going to have intercourse. They could be intimate in different ways, but she wasn't going to have that penile-vaginal intercourse until after she got married. And then she felt like that was more in accordance with her values and what she believed. And so then she realized that she didn't have that stress and that same shame and guilt,
I have to ask, did she get married, and was she able to successfully have pain-free sex, or?
Yes. So when she eventually, right. So when she then, after she married, then she was able to have pain-free sex. But it's so interesting, right? What the brain does and what it tells you and what it does to try to protect you. And to your point, right? A lot of patients who have vaginismus, obviously not all, but some patients that have vaginismus could have experienced trauma, abuse, cultural conditioning that they feel, whether it's religious or whether it's just community driven, that, what they're doing is wrong. And so the body is trying to protect them.
This is another reason why it's so important to educate women, because these things that we are told growing up can lead to these problems, like real medical problems, real issues that interfere with not only your own life, but your relationships. So, yeah. And I love that you brought up another cause for sexual pain, which are these vulvar skin conditions like lichen sclerosis, and lichen sclerosis, then there's lichen planus, and these can cause so much scarring of the tissue that it becomes very rigid or inflexible and can cause a lot of pain. Another condition that can cause pain that can also lead to scarring is like surgeries, right? Like patients who've had female genital mutilation, type of surgery, but also just elective surgeries, I think, like vulvoplasties or, labiaplasties, right? Have you seen that a lot?
Absolutely. Yeah. The perioneophyes. I have a hard time saying that.
Oh, right.
Absolutely right. Where women get that, tightening of their vagina because their partners tell them that they're loose or something like that. And then, they end up getting those surgery. But there's so many things, right? There's a lot of reasons.
Right. Even surgeries like just normal, like, vaginal tears. And actually, okay, this is TMI, but I kind of had that. I had, after one child, whatever tear I had that was repaired really was, even after it was well healed, just caused so much pain to have sex. Wow. And what fixed it is, having another child. Actually, like, I didn't seek treatment at that time because I was like, I'm going to deal with this after. I don't advise that to others, but, I had children back to back and that was my plan. And so I delayed treatment, but it resolved after the second. But I wouldn't recommend that approach, but it's interesting.
Definitely. So. Yeah, absolutely. So, some of the symptoms that we talked a little bit about. So with pelvic pain that you can have, it definitely varies according to the severity. We did talk a little bit about how some partners feel like it's like hitting a wall. These individuals oftentimes can have pain with just insertion of a tampon or any type of vaginal penetration. There's a lot of fear, anxiety, pain with the vaginal penetration. When, as I'm sure, Kirti, as when we talk about vaginal pain, there's so many different ways that we do it, but we start with like the end organ, right? So we're looking at that and just what we were talking about, there can be something like lichen planus, lichen sclerosis. There can be desquamative inflammatory vaginitis that can be associated with lichen planus sometimes. I actually had a patient, my first patient that I ever saw that had lichen planus with a DIV, and she had been suffering for 3 years, didn't know who to go to. Finally, her dermatologist actually sent her to me and we worked through it together. And she actually also developed secondary vaginismus due to this condition and some scarring inside. And she noted that every time she had sex, she had blood and there was all this, discharge coming out. And so after she and I worked together, she was doing pelvic floor therapy, but also she ended up doing something that was compounded, that was a steroid, an antibiotic, as well as vaginal estrogen. And when she was doing that, she got much better. And then she was also placing a steroid on the outside of her vulva that helped with the scarring and the cuts that she was getting from the lichen planus. And I'm happy to report that she came back and she told me she started to have sex again. She was feeling great. Her relationship was much better. And she was really excited. And she said now she actually wants sex. And, it's not, it was a fantastic story.
That's great. I know those are some of the most rewarding encounters as patients with lichen sclerosis, lichen planus. Like, they sometimes have seen tons of doctors before. And, I'll see them at the first visit, take a look. Sometimes I will have to confirm with biopsy, but often, that steroid treatment for a couple of weeks and having them back and they're like, "You're amazing."
Wow.
It is really rewarding and because they respond really quickly to the topical
Right.
steroids, right?
Absolutely. Absolutely. It's
So
definitely life-changing for them.
another category that I wanted to talk about was low estrogen, of course, and how that can lead to, pain. And you can
Yeah.
see this not just in menopause, right?
Absolutely. Absolutely. Yeah, right. So any condition, right, in women that causes low estrogen will cause you can have what's considered to be like this painful sex, right? So that can be whether somebody's breastfeeding. We know that. We also know when women are perimenopausal, postmenopausal, they start to have decreased estrogen to their vulvar region. And when that happens, you have decreased blood flow, you have decreased lubrication. You can start to see pain with sex. And it also can cause recurrent UTIs. It can cause overactive bladder, right? So when we start to have those hormones going down, it affects all parts of our body and specifically the vulvar-vaginal area. And so that's why a lot of women can experience that pain with sex. So something that you and I both know, but perhaps your listeners don't know, is that vaginal estrogen, is a lifesaver for these individuals and for most women that are in perimenopause, postmenopause, and even those that have had a delivery and that are breastfeeding, because we know that during those conditions, the estrogen is low, which allows the milk to come into the breast and allows for breastfeeding, but also during perimenopause and of course during menopause when our estrogen levels are almost like zero, it's that a lot of women will have that pain with sex. And some women, initially when they come to see me, they're like, "Oh, I'm not having pain with sex and I'm not having, any problems." And I'm like, "Yeah, but not yet, So this is a progressive condition that unless we treat it can get worse with time. And so it's really, really important that women be assessed for pain with sex, but especially during this time, right? During this perimenopause, postmenopause
Right,
time.
right.
Um,
I know. And another surprising, I think people would be surprised to hear taking hormonal birth control, like the pill, can
yes,
even
absolutely.
lead to an overall lower, like hypoestrogenic state where you might need vaginal estrogen, right?
Right, absolutely. Yes. So you have those synthetic hormones, essentially shutting down the ovarian function. So that's why we're not ovulating, we're not getting pregnant during that time. But those synthetic hormones can sometimes cause hormonally mediated vestibulodynia, which is basically, those hormones, the estrogen and testosterone that are in that vestibular area in the vulva can become pale, it can become thin. And so you really need those hormones back because some women can develop pain with sex during that time. And it's really, really important to realize that and to be treated. Something that we also didn't talk about is sometimes people can have issues with their clitoris. They can have clitoral phimosis. Perhaps that can cause some pain. We know that the vestibule, which is the entrance into the vagina, sometimes when there's low hormones, like you just mentioned with the birth control, that can cause pain. We talked about vaginismus. We talked about all of those vulvar issues that can happen. And, once we move from the end organ, which is that vulvar region, we move up a little bit and we get to the pelvic floor. And we talked about this a little bit with
Right.
vaginismus, but also tightening of that pelvic floor can cause pain with sex. And then as you in Ishwish, we move up to the different regions. So the region one was the end organ. Region two is the pelvic floor. Region three is the spinal cord. So we're looking
Right.
at perhaps the cauda equina, that bottom part of the spinal cord. Region four is when we move higher up in the spinal cord. And region five is having to do with the brain and perhaps neurotransmitters and what's going on there. So when we talk about painful sex, when we talk about pain in that vulvar area, we have to look at all of those different regions. And we do tests to help distinguish what region is being affected so that we know exactly how to treat.
I love that lecture at Ishwish. I really need to watch it again because,
Yeah,
yes, it's such a nice framework to think about this problem.
right,
It's when you first hear it, pain with sex sounds like, oh, it might be simple, a handful of things. No, it's actually quite extensive, like, because there's nerves, muscles, anatomy, right? These hormones, neurotransmitters, so many different things can, can go wrong and lead to this condition. So, yeah, it's quite complicated. So, don't lose hope if you have this problem and you haven't gotten typical treatment you've gotten hasn't helped. There might be some other cause. And yeah, what you were talking about with the anatomy, the clitoris and the vestibule, the vulva, like, it made me think of other anatomy, like even ovarian cysts or fibroids or, even cancer. This is how it can present. So it is important to have that exam, maybe other tests like an ultrasound.
Right, right. Absolutely. And that's why it's so important to not dismiss symptoms if you're having symptoms and just go and get evaluated.
Yes. And even infections, actually, I just thought of that. Like, STDs can lead to pelvic pain. Gonorrhea and chlamydia are notorious for that. Pelvic inflammatory disease can cause pain. So,
right. Contact allergens like like
right.
latex allergy, or if you're using a product that's causing your vulva to be irritated, right? So that can allergens can obviously cause like a contact dermatitis that can end yeast infections, right? Those can always cause
right.
irritation.
I know. Gynecology 101. Yeah, use hypoallergenic products and do the basics, try to wear cotton underwear and things like that, right? Some people do have very sensitive skin. You got to be careful. Yeah. So actually that reminds me, I did have a patient like that. I literally told her to do vaginal rest, like only wash with water. And it's kind of interesting how just taking a break from all the things you might be doing can sometimes solve the problem,
Right. Yeah, absolutely.
So I'm trying to see if there's other things we didn't cover. Oh, another thing, is just realizing that it's not just your genital organs or this system we were talking about. Other medical conditions like gastrointestinal issues can cause, urinary, like interstitial cystitis, urinary tract issues can all, and obviously back pain, back injury, things like that can affect your nerves. Right. So I think that's also interesting to think about. Oh, and we didn't name a big one like endometriosis, right?
Yeah, of course. Yeah, definitely. I mean, that's something that women can develop. And we know as gynecologists, we know that whether or not or how severe your endometriosis does not establish how much pain you're going to have. So you may have a little bit of endometriosis and have a lot of pain, or vice versa, right? You have a lot of endometriosis and you just don't experience any pain. So but yeah, absolutely. Sometimes endometriosis people can have with pain with deep penetration, right? And so that can be endometriosis, that could be fibroids, it could be a cyst, it could be any one of those things.
Right. Did you have any other thoughts on other conditions maybe I didn't bring up, or even other thoughts about, how you approach working up these patients?
Yeah, I mean, I think that, when looking at somebody that has vulvar pain, you always start out with the exam, right? You and I always know that to do a thorough history, to talk about medications, any medications that could be causing painful sex that we didn't, think of, and maybe, and also sometimes when patients have decreased libido, right? And if they're not interested. Right. And that's actually one of the biggest things that women come in for in midlife is decreased libido. And we know that that affects most women. It can affect actually a lot of women in midlife. And there was a study that was done. It was this questionnaire that was given to women regarding sexual desire. And it was a questionnaire that involved 31,581 women. And it was a survey that was done. And what they asked about is if, women were having any type of sexual dysfunction and around what point in their life they experienced that sexual dysfunction. And we noted from that, it's called a Preside study. And from that study, we know that most women who experience any type of sexual dysfunction tend to exhibit it in midlife. So usually around the age of between 40 and 65. And the thing that bothered women the most was actually their desire, then arousal, and then orgasm. And if you take a look at it, it looks like women had about 38.7% of those participants from that study had issues with desire, and about 10% of them presented with distress. So, a problem isn't really a problem unless you have distress with it. It's specifically regarding libido. Sometimes women come in and they say, I have low libido, but it's really not bothering me. Well, if it's not bothering them, then it's really not a problem, right? But if it is a problem where it's affecting their relationship, if it's causing them distress, then it's absolutely a problem. And so then, we discuss that. And I think that is, definitely an important issue. Also from this study, what they noted was that women that reported issues with desire tended to have also other comorbidities with it. So, for example, if they had arthritis, if they had anxiety, if they had thyroid problems, if they had, inflammatory or irritable bowel, or if they had urinary incontinence, those women tended to exhibit some type of sexual problems along with their other, comorbidities. So those women that had issues with like thyroid also had issues with sexual dysfunction. And that's what they showed in this study.
So Sadaf, it has been such a pleasure to talk to you. Your wealth of knowledge. This was really fun. I do hope you come back when you have your book out. Okay.
Yes, I'd love to.
Do you have any closing thoughts for the audience? And also please share where people can find you.
Thanks. So first of all, thanks so much for having me on. I really appreciate it. Yeah, what I want people to know is, we spent a lot of time talking about pelvic pain and pelvic dysfunction and pain with sex. And I want people to leave knowing that there's always hope, and that if they are struggling with painful sex or any type of penetration, to definitely seek out a provider. And, if somebody dismisses you, make sure you find somebody else that can serve you. If you go on ishwish.org, you can find members, but also Ishwish fellows that will take you definitely more seriously. So make sure you go and find a provider that takes the time to listen to you and not dismiss you. So I always like to leave with hope for people, and I don't want them to walk away thinking like, wow, there's nothing that can be done. I'm broken. I have all these problems. No, I want you to know that there is hope, and just it's a matter of finding that person that can really help you out. In terms of, people getting in touch with me, so you can go to my website at www.femvhealth.com. If you are in New York or in Michigan, I see patients via telehealth in Michigan, but I have a private practice in New York that they can come and see me. I have a podcast called the Muslim Sex Podcast. I'm on social media at Dr. Sadaf OBGYN. And I host midlife retreats in Morocco. We have one that's coming up in September that is sold out, but you can be put on a wait list for one coming up in 2026. And
I might join you.
Yes.
I have not been there, and it's on my bucket list. I did not know that.
Amazing. It's an amazing.
You need to send me the date for the 2026 one.
Yeah, absolutely. We're still figuring that out. We might actually do it in April. We've been doing it in September, so we're thinking about maybe moving it up and checking out a different month of the year just to see what the climate is like. But it is gorgeous. The food is amazing. The people are amazing. I had never gone there before last year, and I can't wait to go back. It's so amazing.
Okay. I want to join a future trip. Maybe I'll be like one of your sessions or something. I don't know. Maybe we can be part of that. Yeah, but okay. Yeah. Thank you so much, Sadaf. So I'm going to leave with my closing thought. So in the patriarchy, women are judged and shamed for their sexuality, for seeking sexual pleasure, and sex is often regarded as duty in service to a man. Female sexual pain is often part of that narrative and regarded as normal. But in the Gynarchy, women are viewed as sexual beings just as men are. And we recognize that women have the right to express their sexuality and seek pain-free and pleasurable sexual experiences. So down with the patriarchy and up with the Gynarchy. Thank you so much.
Fantastic. Thank you so much. Thanks again for having me on.
Did you enjoy this episode of the Gynarchy Podcast? Know someone else who might enjoy this conversation? Make sure to subscribe and share the show with your friends and family. Find us on Apple, Spotify, YouTube, and just about anywhere you find podcasts. On social media, we can be found on Blue Sky, Instagram, and TikTok at The Gynarchy. Thank you so much for listening.